So, you've just brought home a newborn. It can feel like you've been handed this tiny, adorable, and, let's be honest, completely confusing little human with no instruction manual. Well, think of this as that manual. We're going to demystify those incredible and, yeah, sometimes bewildering first few weeks of a baby's life. So, let's just jump right in and ask the big question.
It's a massive question, isn't it? I mean, they go from the super controlled, quiet world of the womb to, well, our world. That is a huge transition, and it's packed with some amazing biological feats and, a few quirks that might just surprise you. So let's start at the very, very beginning. That first hour after birth, it's often called the golden hour for a reason. It's this super critical period of adjustment for the newborn, and a whole series of checks happen to make sure everything's on the right track. And the very first thing that happens is a quick but really vital assessment. It's called the APGAR score. Yeah, within moments of being born, your baby gets their very first test, the APGAR score. It's just a fast, straightforward way to check out their physical condition. And they do it at 1 minute old and then again at 5 minutes. Now, what's really important to remember is this is not some crystal ball into their future health. It's literally just a snapshot of how the baby's doing right here, right now.
So, what does APGAR even stand for? Well, it's a handy acronym for appearance, pulse, grimace, activity, and respiration. Each one gets a score from 0 to 2. So a baby who is all pink, has a strong pulse, a good cry, and is moving around actively is going to score high. A total score of 7 or more is what's considered normal. If the score is a little lower, it's not a panic situation. It just tells the medical team that maybe this little one needs some immediate help, like a little oxygen to get them going.
Okay, I know all that scoring sounds a little intense, but here's some perspective for you. The vast, vast majority of babies transition just fine all on their own. In fact, only about 10% of newborns need just a little bit of help to get their breathing started. And if that's not reassuring enough, get this. Fewer than 1%, less than 1, require major resuscitation, like chest compressions. Most babies are just ready to go from that very first breath. The key takeaway here is simple. Medical teams are prepared for anything and everything, but those big interventions are actually really rare. Another thing that happens right away is the vitamin K shot. Ever wonder why that's so important? Well, it turns out newborns have super low levels of vitamin K, which is absolutely essential for blood clotting. So this one simple injection prevents a rare but pretty serious bleeding condition. Think of it as a crucial little safety net. All right, it's super common for newborns to have a bit of a bump or some swelling on their head after delivery, kind of a battle scar from their journey. This breaks down the two most common types. You've got capus succedaneum, which is more of a general, spongy swelling that can cross over the flexible parts of the skull. Then there's cephalohematoma, which is more defined and stays within one of the skull bones. The bottom line, both are typically harmless and just part of the process. Okay, we've got the essential checks out of the way. Now let's get into the fun stuff. The quirks. Newborns have some really fascinating features that might look a little strange at first, but are actually completely normal signs that they're developing just as they should. Newborn skin is a trip, isn't it? You might see these bluish spots that look like bruises, or a blotchy rash that has a scary name but is totally fine. They get these tiny white bumps that look like little pimples, or even pink patches people call stork bites. And then there's the wild one, the harlequin color change, where literally half their body turns red and the other half is pale. They all look dramatic, but they're all harmless and usually just fade away on their own. All right, ready for some rapid-fire newborn trivia? Did you know that when they cry, they don't actually make tears at first? Their tear ducts are still under construction. Also, they can't shiver to warm themselves up. They're born pretty much colorblind, and their pupils are super tiny because their little eye muscles are still figuring things out. Pretty cool, huh? So, wait a minute. If they can't shiver, how on earth do they stay warm? The answer is one of nature's coolest inventions, brown fat. It's totally different from the white fat we have as adults. Brown fat is packed with these little energy factories that generate heat. It's literally like they have a built-in personal heater tucked around their neck and back. It's their own amazing survival mechanism. Okay, let's not beat around the bush. We have to talk about diapers. It's a huge topic for new parents and for good reason. A baby's poop changes a ton in the first week, and it's a great sign of their health. It starts out as this black tar-like stuff called meconium. Then it shifts to a greenish brown, and finally, by about day 5 or 6, you get that classic golden yellow. This is your roadmap to what's normal. A newborn's immune system is basically a clean slate. It's a work in progress. So how do we protect them during these fragile early days? Well, it turns out there are some really powerful ways, both high-tech and low-tech, to build up their first line of defense. Let's start with one of the most powerful yet simplest methods out there, kangaroo mother care. It's pretty much what it sounds like. Lots of continuous skin-to-skin contact. It's especially amazing for preterm or low birth weight babies because it helps regulate their temperature, their heart rate, their breathing, and it's amazing for bonding. And it really is as straightforward as it sounds. The baby, just in a diaper, is placed right on their mom's bare chest. You turn their little head to the side so their airway is clear, support their bottom, and that's it. It's an incredibly simple technique, but for a tiny, fragile infant, the benefits are just massive. And of course, on the more high-tech side of building immunity, we have vaccines. At its core, a vaccine is really just a training manual for the body's immune system. It introduces the body to a harmless part of a germ, which stimulates it to produce an army of antibodies. That way, if the real disease ever shows up, the body is already prepped and ready to fight. So we've covered those very first checks, but now let's talk about tracking their incredible growth. The first year of life is just this absolute whirlwind of development, and it really kicks off right away. Now, here's something that can freak out a lot of new parents. That initial weight loss. But listen, it is perfectly normal. Most newborns lose up to 10% of their birth weight in the first few days. The key milestone, we can call it the 10-day rule, is that they should be back up to their birth weight by about day 10. And you know, while those first few weeks feel like they're just about eating and sleeping, this is what's coming right around the corner. By 3 months, they start getting control of that wobbly little head. By 6 months, they're sitting up with some help. And before you know it, around 8 or 9 months, they're sitting all on their own and even pulling up to stand. It happens so fast. So when you just step back and look at the whole picture, from that very first breath and the APGAR test to growing their own personal heater with brown fat and all those weird and wonderful quirks in between, the first few weeks are just a biological masterpiece. It's incredible. So I'll leave you with this to think about. What part of this amazing journey from the womb to our world do you find the most incredible? Thanks for joining us for this explainer.